The state of men's osteoporosis worldwide is shocking. Although women are at greater risk of developing osteoporosis, men who get it break more bones, have more complications, more disability, and die at higher rates than women. So why does this happen? And what can you do to help yourself or the man in your life? Well, that's what we're talking about today. My name's Dr. Tomasz Forfa and I'm a retired medical doctor. I was diagnosed with early onset osteoporosis almost 4 years ago now, and I reversed it naturally. Now I'm on a mission to help other men do the same. Truth is, it's a big job. Let's have a look at this. Here's the current reality of osteoporosis for men worldwide. According to the Osteoporosis or the International Osteoporosis Foundation, 1 in 5 men over 50 will break a bone because of osteoporosis. 1 in 5, right? Whereas 1 in 4 men over 50 in North America will break a bone due to osteoporosis. So it's worse for our North American men. Men who have osteoporosis break more bones than women with osteoporosis, even at the same bone mineral density values. And out of those men who break a hip, 1 in 5 will die in the first 12 months after it. That's much higher than for women. And it's only getting worse from there, because by 2050, the worldwide incidence of hip fractures is projected to more than triple in men and double in women compared to the rates in the 1990s. When you compare it to other diseases, men are more likely to have osteoporotic fractures than they are to get prostate cancer. And the disability due to osteoporosis is greater than that caused by all cancers except for lung cancer. Having one osteoporotic fracture gives men an 86% increased risk of another fracture. This risk is especially high in the first 2 years after the first fracture. So immediate care is essential. But most men, especially some people even say up to 80% of men who have that first osteoporotic fracture are neither identified or treated. 80%. So men are breaking more bones, suffering more after a fracture, dying more frequently, and most are not identified or treated. Now, overall, women are at a greater risk of developing osteoporosis, and we need to support them better too. However, men are suffering and dying at much higher rates. So why is it so bad for men with osteoporosis? Well, let's have a look at this. There's a number of reasons. Firstly, since osteoporosis is much more common in women, researchers and doctors mainly focus on studying and treating osteoporosis in women. And so because of this, most of the ways to diagnose the disease are made for women. Also, there's essentially what this means is that there's a gender bias in the clinical management of osteoporosis, which penalizes men. So let's break this down a little further. Let's look at screening, for example, screening for osteoporosis. So when we talk about screening, what we're referring to is checking if someone has a condition. So they might not have the signs or symptoms yet, but when screening, we're doing a test to see if they have the early signs of the disease. That's called screening, and it's done for many different conditions for people of all ages and genders. When it comes to osteoporosis, however, women get checkups and screenings more than men because they're more aware of the disease. Men usually only get bone tests after they have fractured something or have other health problems. So men have to break a bone first. And as we heard earlier, the first fracture often means they'll have more fractures and things can deteriorate from there. Many doctors don't know when to screen men because there aren't clear signs or guidelines for when to do it or what age or how to do it best. And it's been unclear for a long time. There are some guidelines, like for example, the current Endocrine Society clinical practice guidelines recommend screening all men over 70 for osteoporosis. Problem is, it doesn't happen. one study discovered that less than 6% of men get DEXA osteoporosis screenings, while more than 93% of women over 65 years old get it. Now, even if it did happen and men were, being screened over 70 is too late, in my opinion. We should be doing it far sooner because there are risk factors for men, such as hyperparathyroidism, chronic renal failure, prostate cancer treatments, hypothyroidism, hypogonadism, and many others. And because of this lack of awareness, men are also not getting preventative treatment at the same rates as women. So men are not being screened adequately for osteoporosis and are not getting enough preventative treatment, but it gets worse because a number of studies have shown that when men do have fractures, the majority of them just get treated for the fracture, but not the underlying osteoporosis or its cause, which can only lead to more fractures. Right? Then when it comes to the actual treatment, it's often unclear which treatment is best because research shows that men are not included in as many osteoporosis studies. So doctors don't know enough about how the disease affects them or how the treatments work best for men. Now, by the way, all these studies that I'm referring to are in the description below this video. So men are not studied enough, often not diagnosed, and not treated properly for osteoporosis. Right? Finally, to top all this off, right, men's bones work differently to women's. Men are not just big hairy women, right? But when it comes to osteoporosis, that's how they're treated. Here are just some of the differences, right? The most obvious being hormones. Men have more testosterone and women more estrogen, both of which have a significant effect on bone loss. Also, men's and women's bones develop differently in early life, which affects them later on. After menopause, women lose bone faster than men of the same age, whereas bones of men over time grow more on the outside and less so on the inside. And then there are differences in the cells that break down bone in men and women. Men also get secondary osteoporosis at much higher rates, meaning their bone strength is reduced because of a medical condition or a medicine that they're taking. But in women, the main cause is usually getting older and going through menopause. On top of this, right, T-scores don't fully represent bone quality, especially in secondary osteoporosis, which is common in men. This has led some studies to believe that we need gender-specific cutoff scores because men who have fractures tend to have higher T-scores. And so this suggests that we might need different criteria or additional tests to assess fracture risk and decide on treatment in men. So what does all of this mean and how do we fix it? Well, it means that there's a big gap between what we know from the research about men's osteoporosis versus what doctors are actually doing about it. And to fix this bias, we need to make people aware, more aware, and give men better access to screening. That's one of the main reasons we started this YouTube channel focusing on men's osteoporosis. So please hit subscribe to help us get the word out to more men and more doctors. So what this also tells us is that yes, screening for osteoporosis in men is important, especially in those who have risk factors in it, since we often have secondary osteoporosis. But even more so, what's important is the education and support men get immediately after their first fracture. That is why we started our online short course specifically designed for men recently diagnosed with osteoporosis and osteopenia. It introduces you to the core groundwork needed to start improving your bone density and quality. And you can find out more about that in the description. But for now, here's what you can do about your osteoporosis as a man or for help the man in your life. Number one, look into the causes early on. Don't just jump into treatment. There are causes and other factors to consider here first. Second, get treatment for any injuries that may be hindering your ability to exercise and affecting your balance and coordination, as well as addressing the underlying causes. Number 3 is find safe and effective bone building exercises. Building balance and coordination and strength can prevent falls and strengthen bones when done correctly. And finally, the 4th thing is to make sure that you're getting the right nutrients and vitamins to support bone regeneration and strength. So that's it. If you have any questions, please put them in the comments below, and let's get men's osteoporosis out of the shadows.